Hi, we are here today to talk about something that is starting to become a more common problem for both men and women, but especially women. And we need to bring it to light so more people know about it, because as it turns out, there are often no warning signs or feelings. We're talking about fatty liver disease, and Dr. Marina Roytman from UCSF is here with us today to help inform us and help us protect ourselves as well. Dr. Roytman, thank you for being here.
Thank you for having me. I'm so excited to talk about this important topic.
How long have you been working with patients on fatty liver disease?
I've been working with patients for about a decade and a half.
Oh boy, okay. So this isn't something that has just recently come on, or are you seeing way more patients now?
Yes and no.
Okay.
So fatty liver disease has been an issue for a long, long time. We probably have known about it for at least 20 to 30 years. But in the past, a lot of the times doctors kind of blew it off. They were like, well, you have a little bit of a fatty liver, don't worry about it. But over the last decade, number one, we realized that fatty liver disease is a serious problem, just like drinking or hepatitis. And at the same time, we have an epidemic of obesity in the United States and most of the developed world, which is the second reason why it's becoming more of an issue.
Okay, well, let's then talk about what is fatty liver disease. I mean, does it just mean fat in the liver?
Great question. So yes, fatty liver disease is fat in the liver, but the problem is that the liver doesn't like to have fat in it. So it promotes an inflammatory response. What it means is lots of inflammatory cells from the rest of our body come to the liver and cause inflammation. Inflammation is like swelling of the liver, and having years and years of inflammation will lead to liver scarring. A lot of scarring over many years will lead to something called liver cirrhosis.
Well, we've heard cirrhosis of the liver and usually put that together with alcohol.
I hear this over and over again, and I see a lot of patients who come to my office very distressed, and they say, Dr. Roytman, how could I have cirrhosis? I've never drank. And this one of the first things that I do is I reassure the patients, unfortunately, or fortunately for them, there's many diseases that can lead to liver cirrhosis. It could be viral hepatitis, it could certainly be drinking, it could be fatty liver disease, it can be autoimmune liver disease. So absolutely, you can get to cirrhosis without drinking.
Okay. Now you're talking about all this inflammation. It seems then that you would feel, I don't know if it's on the left or the right.
It's the right.
It's the right side, okay. Would you feel a pain in your abdomen?
Again, a very common question. Patients come and see me and they're like, how could I have this progressive liver disease when I've never felt bad? And the thing is that the liver as an organ doesn't really have a lot of nerve endings. So even patients with severe liver disease do not feel pain, which makes it very, very challenging for us as clinicians to diagnose liver disease.
Well, how does it get diagnosed then?
That's another great question. So for one, we as physicians have to pay attention to the patients who are at risk for fatty liver disease.
Okay.
And patients who are at risk for fatty liver disease are those with what's called a metabolic syndrome. And metabolic syndrome includes having diabetes, high cholesterol, high blood pressure, and being overweight or obese. Specifically, if our weight is stored kind of in our midline, which is called central obesity. So when we as clinicians see this type of patients, we have to think automatically not only about the possibility of heart disease, which is a huge issue in patients with metabolic disease, but about liver disease. And we have to proactively screen the patients for it.
Is it a simple blood test?
Yes and no. Again, a complicated question. So certainly the first good place to start is a simple blood test, which will tell us liver enzymes. Liver enzymes would be elevated if your liver is inflamed. So that's one thing. However, patients with more advanced liver disease may not have elevated liver enzymes. So that's another challenge. So a really great way to screen patients for fatty liver disease is a technology called FibroScan, or a really long word, vibration controlled transient elastography. And it's not a new technology. It's been around for, at least 10, 15 years. And it's a non-invasive test similar to ultrasound. And in about a 15-minute procedure, it can tell us two things: how much scarring is in the liver, or how close are you to cirrhosis, and how much fat is in the liver. So is fatty liver disease really playing a big role in your disease?
I had a family member recently get a test. I'm thinking it was this, and he said it felt like just a little pound pressure, just a little bit, over and over and over again as it went to take the pictures, or?
So exactly. So you're describing the test perfectly.
Oh.
So it feels like, a little punching on the shoulder or thumping, and yes, it is done in the area of the liver.
But not painfully in any way.
Not at all. Not at all. It just feels like a little tiny punches.
Yeah.
And what the test does, it's a little probe, and the probe generates a shear wave. Shear wave goes through the liver, and then it comes back, and the same device can measure the speed of the shear wave.
Okay.
So I'll explain a little bit how that works.
Yeah, please.
So if we think of a liver as a rubber ball, right? And a healthy liver is going to feel and look like a nice squishy rubber ball. So when the shear wave travels through this soft squishy liver, it's going to take a long time to travel through it.
Okay.
If the liver is cirrhotic and hard as a rock, the shear wave is going to go much quicker through this liver. So on the back end, we can measure it, and we can correlate the degree of scarring to the speed of this wave travel.
Wow.
So it's super cool.
Okay, yeah, it is. And just to make people be really assured by this, is that it really isn't painful, and it's not invasive, and it doesn't go into the body. There's no pricking or anything. It's just on the outside, on the skin.
Absolutely. This is completely non-invasive. The closest thing we can correlate it to is an ultrasound. And you may have had ultrasound, of your liver, of your kidneys, or if you were pregnant, to take a look at the baby. So a little bit of cold gel, or warm if we warm it up for you, gets put on the belly, and then there's a little probe that is put on you, not in you, but on you. And it takes about 10 to 15 minutes, and it provides us with a lot of clinical information.
All right, so let's say the information comes back and says, looks like you've got something going on here. Can it be reversed? Can I make serious changes in my own life to reverse that fatty liver disease or scarring?
Absolutely. And liver is the only organ in the body that can regenerate or rebuild itself. And what is fascinating is even patients with advanced scarring or even cirrhosis can rebuild their liver. So this is remarkable. For the long time, we thought that once you've built the scar in the liver, it's irreversible. But now we know that is not the case. And I think that's fantastic. And since having a metabolic syndrome and being overweight is what gets us into the fatty liver, working in a metabolic syndrome and losing weight is what gets us out of the fatty liver. And when we talk about weight loss, and I talk about weight loss all day long with my patients, we're not talking about massive weight loss. We're talking about 10% of total body weight loss will cause reversal, not only of the fat of the liver, but of the scarring of the liver.
Wow.
So if the patient comes in and let's say they're 200 pounds, right, all they need to do is lose 20 pounds to cause this dramatic reversal in their disease.
Wow. Are there drugs too that could help?
There are drugs too. However, the drugs are not instead of what we call lifestyle modifications and weight loss. Weight loss, exercise, and healthy eating, specifically Mediterranean diet, is what's thought to be the best for fatty liver, are the cornerstones of how we're going to manage it. Now, there has been a medication approved this spring that causes fat loss in the liver and reversal of fibrosis. At this point, we're using this medication for patients with more advanced scarring and not for early scarring. And I hope, and I think most of my colleagues will agree with me, that there's many new medications that are on the horizon that is going to help managing fatty liver disease. Again, all of it in addition to our lifestyle changes.
Yeah, it sounds like that really is key. It's often said food is medicine, or it can be if we are eating the right food, not
Correct.
out of the vending machine or something.
Exactly.
You said that this can happen to both men and women, but are you seeing it more in women, and why would that be?
This is, again, a great question. And I think there's probably lots and lots of reasons that science just hasn't gotten around to explaining them. But we know that genetically, women obviously are different from men, and that could be part of the reason why women are more predisposed to it. To highlight a certain population, we have a large Hispanic community here in Central Valley. And in the patients of Hispanic origin, there is a genetic difference, a genetic polymorphism called PNPLA3 genetic polymorphism. And this polymorphism makes patients of Hispanic ethnicity more prone to fatty liver disease, even though they may not be as obese or having as many metabolic components as, say, a Caucasian patient. So when you look at a patient who is female and of Hispanic origin, that's a double whammy in terms of their risk for development of fatty liver.
Is there an age that we should really be concerned about? I mean, I know you're talking about lifestyle, so if we have a good, healthy lifestyle throughout our life, then then we have less to worry about. But do you see more of this happening at 40 on, or menopause on?
So I wish this was happening at 41, but it isn't. We're actually currently doing a study with Fresno State Department of Nutrition, and we're looking at healthy, or presumably healthy, college students. And we're putting those college students through many metabolic tests, and we're doing the fiber scans on all of them. And those are the students in between 18 and 25, let's say. And in these students, we see a tremendous amount of fatty deposition in the liver already. And not only are we seeing the fat in the liver, in a good proportion of those students, we also starting to see the fibrosis or scarring of liver disease. So this is happening, in the students in their, early 20s. So from my standpoint, we really need to start way earlier. We need to start in elementary school and teach the kids and the parents the importance of exercise, the importance of maintaining a healthy weight, and the importance of relying on healthy natural food and avoiding processed and specifically ultra-processed foods.
Okay. Wow. I'm just saddened and befuddled to hear at such a young age. You have a liver expo coming up October 12th. Tell us about it, because it will help a lot of people maybe find out if this is what's going on.
Absolutely, thank you. Liver Expo is a community-oriented event specifically designed to help people learn about liver health and liver disease. It's a super fun event. It happens at UCSF Fresno downtown. And we have lectures about liver disease and liver health. We have free fiber scans. We have free hepatitis C testing, healthy cooking demonstration and eating, as well as some ideas of how to exercise. So it's a fantastic event, and I really hope that our listeners can take advantage of it.
I hope so. This has really been eye-opening. I had no idea. So when this topic came about, I'm really glad that you were able to inform us and help us live a longer life.
Thank you. Thank you. I'm really happy to share this with our audience. Thank you for having me.
Thank you.
Hi, I'm Monty Torres with Fox 26 News on YouTube. Thank you for checking out our YouTube channel, where we have loads of great content for you to choose from. And while you're here, why not click on the subscribe button right here? That way you can stay in touch with all the latest breaking news, everything news related within the Central Valley. And thank you for watching.